talking about stem cell research and the ethics involved. The presenters are Melanie Funk, Aaron Lunt, Crystal Weber, and Carmen Winnicke. Basically, stem cells are cells that don't know what they want to be when they grow up. That was a definition given to me by my physiology professor on my undergrad, and it's always stuck with me since. It's a very good way to explain what a stem cell is, as they are undifferentiated. They don't have a pathway yet as far as what cells they're going to become. So that makes them really helpful in science because we can induce them to differentiate into specific tissue types for therapies in the future. Some types of stem cells are embryonic stem cells, tissue stem cells, and induced pluripotent stem cells, which we will talk about further. Embryonic stem cells are the ones that stir up the most controversy and discussion, and they basically have an unlimited potential to produce specialized cells since they have zero differentiation as their embryos, as we know, develop into a vast variety of cells to be able to create the embryo. So this idea suggests vast possibilities for research and disease and treatments. They are very ethically questionable because the use of embryonic stem cells, you have very few stem cells to use, so they would use the entire embryo, which then destroys the embryo. And then there are claims of difficulties in research saying that there's tumor growth, unpredictable mutations such as cancer that result, but when actually digging into the research, there's very little evidence to back these claims up. Tissue stem cells are probably the most commonly used when considering research. You have blood and skin stem cells. Probably the biggest user in that is fibroblasts, which are often used in cloning because you can take the fibroblast nucleus and insert that into an embryo, which then will become a cloned animal. Cord blood, as we have heard in the media, can treat blood disorders such as leukemia and the person who donated the cord blood. Mesenchymal stem cells are also used, but they're not quite as successful as they're multipotent, not pluripotent, meaning that they already are somewhat differentiated. But they can be used to treat bone marrow diseases and other disorders that are involved with bone marrow in the host. Hematopoietic stem cells are used a lot in people who have bone marrow cancers and often used in lieu of bone marrow transplants. So you could take a donor's hematopoietic stem cells and use those in the person suffering from the cancer, and usually can help produce new healthy cells. Induced pluripotent stem cells are probably the biggest advancement in stem cell research to this day, as basically what scientists have been able to do are to take already differentiated cells and undifferentiate them into pluripotent stem cells. So basically we're taking cells that have decided what they want to be and we change their minds and unprogram them. This has had a huge impact on research as it kind of annihilates the use for embryonic stem cells. It's a lot less controversial. We can actually get funding for it and move forward in stem cell research. The main focus on ethical concerns is on embryonic stem cells, mostly focused on the way that they are harvested. They are mostly in vitro fertilized stem cells that were going to be used in vitro fertilization, and you only implant so many, and so whatever is left over is discarded. Well, then in considering embryonic stem cell research, they decided to take these, what normally would be discarded stem cells, and use them for research to be able to create, let's say, a new kidney or pancreas or whatever somebody with a disease could benefit from. The destruction of the embryo is very similar to the view of abortion when considering the Christian side of things. They look at verses in the Bible such as Psalms 139:13 and Jeremiah 1:5 in reference to the fact that God has created us in the womb. Therefore, He has had plans for us before we were even, born. So the thought that we have these embryos created in the womb, or in this case in vitro, they already have plans and God has plans for them, and so destruction of these is actually destruction of a life. So, and the science view more or less is like, well, we are going to discard them anyway, so why can't we just use them for the benefit of somebody else? Efficacy is brought into concern because there's a lot of groups that claim that embryonic stem cells are, like I said before, cause all these kinds of problems with tumors and cancer, and the efficacy of them is poor, whereas this is not necessarily backed up, but there is lots of propaganda out there. I remember when I was in middle school seeing these pamphlets that my church was passing out that all it was a piece of paper, and on it said that stem cells implanted into mice are growing tumors, and these tumors are actually fetuses doing what they were meant to do, become babies. And this is obviously very, very incorrect, and I believe I threw those pamphlets away before anybody saw them, because even in middle school I understood the reliability issues there. Another problem is you still face tissue rejection. It's better than like strangers, non-host donor rejection still does occur, however. Like I said, it's a little bit better than like organ implants, but still an issue. So here's some examples of propaganda. On the left we see a little embryo, and it says, "If embryonic stem cell research kills me before I wake, I pray the Lord my soul to take." Obviously this picture shows a formed baby, and this is not the case with embryo stem cells. It's about like 10 to 20 cells that we're harvesting. We're not harvesting a full-grown baby. "I died waiting for embryonic stem cell research to find a cure. What about you?" I was the embryo. Again, suggesting that we are murdering babies to be able to perform embryonic stem cell research, which is a view highly held in people who don't necessarily understand how it works.
Okay, continuing back with the ethical dilemma, there's basically two sides that come up when talking about stem cell research. The side for stem cell research is looking at the advancement of medicine and science, and the other side that is against embryonic research is the respecting of the value of the human life. So, the potential that comes with using the embryonic stem cell research for the advancement of medicine and science ultimately comes with a price, is what the people that are against it is saying. They are destroying what would be a potential life or killing an innocent human being. Some say that the beginning of life begins at fertilization, at the emergence of the one-celled zygote that may attach to the uterus wall and produce a new life. They say that the beginning of life is at the direct moment of fertilization because the early development of the embryo takes specific coordination and cell differentiation. The other side says that human life begins after the cell differentiation has occurred, which is approximately 16 days after fertilization, to one resource. So, what does personhood criteria say? One side says that after fertilization, differentiation of cells begins, and it is difficult to pinpoint the exact specific time during which development that life begins. It is instead a process that begins upon fertilization, and for that reason, life begins at fertilization. The other side says an early fertilized embryo that is in the process of differentiating is not yet implanted to the uterus, and without being implanted, the embryo cannot develop. This is when the embryo would be being harvested or being taken for the research. If the embryo is not yet implanted, then life has not yet begun, and it does not have psychological, emotional, or physical properties. So, along with those properties comes the embryo's moral status. Fertilized eggs are just like any other cells of the person's body until they have developed or differentiated enough to survive on their own. So that's going to the fact and looking like these cells are just like cells that would be transplanted if somebody was getting a heart transplant or a kidney transplant. They're just like any other cells of the body until they begin to differentiate into the embryo and fetus. If a fertilized egg is destroyed before the implantation to the uterus and before it becomes that fetus, no harm is done because it has no moral beliefs, desires, or life expectations. By taking the embryonic stem cells and using them for research, We are preventing the embryo from becoming the potential of developing in its normal way. This means that the cycle of human life is interfered with and that it could potentially result in a life, and that is compromised. So, going back to where these embryos that are used in research come from. Like stated earlier, the main place is fertility treatments. Originally, they were created to be a potential offspring and create life, which causes many issues for people who are against the research. But these spare embryos that are left over, per se, from the fertility treatments are either stored for that couple's future reproductive use, donated to other infertile couples, donated to research, or discarded. The issue for those four embryonic stem cell research, an argument against those that are against it, are asking what's the difference between just discarding these embryos that are unused or for using them in research? Is there really any difference at all between the two? And then the other side is that there are embryos specifically created for research, and these are used as a tool for bettering life. These embryos are created through cloning technologies that may aid in the research on specific genetic mutations. And these specific genetic matches may be of even more benefit for stem cell recipients. And like stated earlier, one of the big ethical issues is that of differing religions. Some religions that are Christian are very conservative, and they state that the embryo has the status of a human upon conception. Some of the groups with very strong conservative views are Roman Catholics, Orthodox, and conservative Protestant churches. But other religion groups, such as Judaism and Islam, have an idea that helping others is more important than, per se, conserving. Because it's going towards the greater good of humanity. They state that the embryo is not really a human until 40 days after its conception.
Alright, so some of our outcomes for our patients, if we were to do this stem cell research, there is potential for curing untreatable diseases such as Parkinson's, and also a study showed that a stem cell transplant also was able to cure blindness. It also becomes another mean of treatment for diseases such as cancer or hearing loss. These can be more affordable treatments, they can be easier treatments, and in some cases they might not be as harmful as some of the chemotherapy and stuff that we are doing for cancer right now. One of the negative effects is that our patients need to be monitored very closely for complications, which is the same as a lot of different procedures in the medical world. We need to make sure things aren't going wrong and to catch negative effects early so that we have the best chance in saving and curing and treating our patients. The top four that California is currently working on with embryonic stem cell research is heart failure, Parkinson's, stroke, and insulin-dependent diabetes. The Genetics Policy Institute stated, with an aging population and rising rates of obesity, it's critical to our nation's economic security that we fully explore all types of cellular therapies for their efficacy to treat these and other chronic and degenerative medical conditions. This way we can save some money potentially in the future, and we'll have some treatments for things that aren't treatable right now. We can also reduce the cost of the treatments that are lifelong, such as insulin-dependent diabetes. Outcomes for healthcare. Human stem cells right now in California are being used in a clinical trial approved by the FDA for treating spinal cord injuries. We're also regenerating damaged tissue, and by doing stem cell research, we are also providing jobs to many people in the healthcare field. As for costs, the evidence has showed in California, where they're currently doing this research, reduced costs for expensive diseases like the insulin-dependent diabetes. That's a disease that causes a lot of people a lot of money each and every year, taking insulin each and every day. And it was shown that even if you can reduce the amount of insulin, if it's not even a total transplant success, we're still saving a ton of money each year. It's about $250 billion we spend on diabetes care alone. It's also going to, like I said before, create jobs. I think it was about 13,000 new jobs from this stem cell research that they are doing there. But like I said before as well, there's the new therapies that are going to be cheaper than the current ones that we're using, and that reduce costs of treatment for long-term diseases. The human stem cell research has the potential to save over that $250 billion in the U.S., and that's the cost for 5 diseases that it holds significant promise for curing. And if we were to stop doing this right now, $500 million of our taxpayer money has been invested into this research, and a decade of our progress would be lost if we were to stop.
The impact on nursing practice. One of the big things I noticed as reading through the articles was education. Nurses will need more education on stem cell research in order for them to adequately care for their patients, the effects of treatment physically, and the biggest one was the psychological effects it can have on the patients as well as the nurses. The moral stance. Nurses must have a clear moral understanding of where they stand on stem cell research or the treatment options that are available for patients. A study done in Turkey looked at the burnout rates of stem cell transplantation nurses and found that many of them burned out psychologically before physically. They proposed that this burnout was due to the rigorous treatment and the nurses not having a full grasp over their moral stance on the issues of stem cell treatment. The study looked more in depth into the nurses that cared for patients undergoing hematopoietic stem cell transplantation and its effect on the nurses. They found that this particular treatment is a stressful modality for patients, their caregivers, and the healthcare personnel. They believed that the HSCT procedure, that's the hematopoietic stem cell transplantation, has a high stress rate due to the fact that it carries a significant morbidity and mortality risk and can produce physical and emotional stress associated with the toxicities that are related to the conditioning regimen. The suggestions that this study came up with was that nurses should undergo a psychiatric program before becoming a nurse in the stem cell treatment area, as well as nurses working with patients undergoing stem cell treatments should partake in more continuing education that involves how to deal with ethical dilemmas that nurses may be exposed to while assisting these patients. This way they would have a better understanding of how to deal with the difficult questions that patients or other family members may ask. Support for the cause. The American Nurses Association recommended the promotion of nursing presence in the international and national debate related to the scientific, ethical, legal, and social implications of advances in genetic science, including human cloning and stem cell research. The American Nurses Association recommendations stated that they support the education of nurses through their academic curricula and continuing education in matters related to stem cell research and therapies as they are developed for use in clinical practice. Also, to continue to be involved in the national and international dialogue on political, scientific, ethical, legal, social, and economic perspectives of stem cell research. And they also encourage nurses as individuals and as professional community to maintain awareness of the practice outcomes translated from stem cell research and respond appropriately.
Here are our references.